To Health Check 10 now, the downside of treating high blood pressure.
Serious swelling can come with some drugs. That's why Rhode Island Hospital is taking part in a new nationwide study. Here's Health Check 10 reporter Barbara Moore-Silva.
Rhode Island Hospital has the busiest emergency department in the state. As a result, they see more of many conditions, including something called angioedema, which is painful and sometimes life-threatening swelling.
So some people genetically have this predisposition to swell. It's called hereditary angioedema, and there's a drug that prevents that, and it's on the market.
Hereditary angioedema is rare, affecting less than 1% of the population. And this drug, icatibant, is used to prevent and relieve symptoms. But ACE inhibitors, a class of drugs used to treat hypertension, can trigger this type of swelling.
It can happen anywhere on the body, but what concerns us as emergency physicians is when this happens in the face, in the mouth, and in the throat.
That's when it can become life-threatening.
Once they develop this, then the ACE inhibitor is no longer a choice for them. They have to stop taking it.
And go to the emergency room because the swelling, which comes out of nowhere, can progress. Because there are millions on ACE inhibitors, they see them quite often in this ED.
We see probably one patient every other day.
Dr. Salim Sooner says there are no real effective treatments for ACE inhibitor-induced angioedema, but when they've used this drug, icatibant, off-label on patients, he's seen dramatic improvement. And now, as part of a national study, patients who come in with this condition can agree to enroll in this study testing the drug's effectiveness. They'll either get the real thing or a placebo, so they can know for sure the icatibant is effective.
If this works, this will be the frontline #1 treatment for ACE inhibitor-induced angioedema.
Again, this ACE inhibitor-induced angioedema is pretty rare considering millions of people are on this class of drug, and Dr. Sooner warns it's never a good idea to stop taking a drug before talking to your doctor first. Participants in this clinical trial must be at least 18 years of age and meet other criteria. For more on that criteria and this clinical trial, you can log on to turn10.com and click on Health. And that's Health Check. Barbara Moore-Silva, NBC 10 News.